Hi, this is Dr. Keith McAfee. Welcome to Medicine and Faith, where I take a subject of medicine and relate that to our faith. Today, I'm going to just make a short chapter on asthma again. Chapter 2. I want to talk about one specific part of asthma. So let me briefly review what I went through before, and I refer you back to my original video log on asthma if you want to go through this in more detail. But briefly spoken, you have a big airway. There are 3 problems that happen in asthma. 1, the wall gets thick. Number 2, you get all this mucus. And that produces problem number 3, which are the muscles that contract, shrinking the airway down from the outside with the mucus, giving you a really small airway to go through. Again, this is too abbreviated. You really have to see my other video for more details. But I wanted to briefly put this up again. How do we treat this? Problem number 1, we do the rescue inhalers, or in this case, I'm going to talk about the rescue nebulizer treatments. And here we use all the other ones, including the steroid, the steroid nebulizer treatments. This makes you feel better right away. This actually fixes the problem by getting rid of the swelling and the mucus. Now, when you use a nebulizer treatment, basically the machine pumps air through a tube that goes to a little cup. You put the medicine in the cup and it mists up and you breathe the medicine. You breathe it into the lungs. The rescue part of it, the albuterol or Xopenex, 2 options, makes the muscles relax. And then if you're using the steroid aspect, the budesonide we call it, that then gets rid of the inflammation and the swelling. This makes you feel better for the moment. This really fixes the problem. But the question I'm often asked is, what dose do you use? You have a young child, 2 years old. You have a teenager, 17 years old. You have somebody my age. You have somebody very, very elderly. Notice I didn't call myself very, very elderly there. Very sleight of hand, I would say. The treatment, the dose I actually use in all of those patients is the same. So I use the same dose in a 2-year-old that I use in someone my size and my age. Why does that make sense? Well, think about it. Here you have a young 2-year-old child, and this is not drawn to true scale, but you have lungs that are this big. Somebody my age, a lot bigger. So when the mist, which comes from the machine, mists at a certain speed, because the machine is preset, it just comes at you at speed X, and it's not going to change per person, all right? It's the same for this person, 2-year-old, as it is for me. The 2-year-old has small lungs. They take a little bit of breath, take a little bit of that medicine in. Most of this mist goes right by them and just blows into the air. It doesn't get into their lungs because their lungs are small. They can only take in so much. For me, I take in a lot bigger breath. I take a lot bigger dose. Less goes by, more goes in. So depending on the size of your lungs, you actually dose yourself, so to speak. We sort of automatically fix our doses according to our lung size. And that's why it makes it very easy. I can give the same prescription for an entire family and they all just use the same dosing because they're automatically dosing themselves. It's a very interesting point that can relate to our spiritual life. In a sense, if you think about it, God does not play favorites. He gives the same graces, or I should say, He wants to give the same graces to everyone. His presence, His joy, His love, His humility, His sacrifice, His suffering, all these things that He wants to bring to us for our own good, He wants to bring those and give as much as He can to every single one of us. It's interesting, though, how we sort of self-dose ourselves. Oh, thanks God, but I just really only want a little bit. Just enough to make my life comfortable, but not enough to disturb my favorite activities. Or, God, I really want to be a saint. I really want all of you. How much do you want to take of God's graces? Because He's blowing that loving mist, His presence, His graces, He's blowing it by you, just like He's blowing it by me and everybody else. Do you want to be a 2-year-old? Do you want to be an adult? Oftentimes I use the analogy of God wants to fill us to overflowing. That's actually very scriptural. Well, how big of a vessel do we want to be? Do we want to be a little sewing thimble? Do we want to be a coffee cup? Do we want to be a swimming pool, the Pacific Ocean? How much of a vessel do we want to be? He can fill us to overflowing no matter how big we are. We kind of determine what kind of size of vessel we want to be. We determine the size of our spiritual lungs. So my encouragement to you and my encouragement to me, we share this, is let's try to develop big lungs. Let's try to make sure we have as little of God's graces going by and floating into the air, missing out on those as possible. Let's get big lungs when we talk about our spiritual lives. I encourage you, I encourage me. Thank you for listening. I look forward to talking to you again soon. I hope you enjoyed this video. If you would like to see other such video logs, please go to my website, KeithMcAfee.com. There you'll also learn about my book, Breathe, A Physician's Stories and Reflections on Prayer, published by Westbow Press, a series of 45 true stories from a medical career, and how that relates to our prayer life. Thank you very much for listening. I look forward to talking to you again soon.